Just when we thought we were free from politics when it comes to public health and the side of the COVID crisis, Donald Trump once again drags us down. FDA approval of the Pfizer COVID vaccine, it was expected tomorrow, free from any political pressure. That was until today. Trump, he's now demanding the agency approve the Pfizer vaccine today, and Trump told his chief of staff that the FDA chief, this guy, Dr. Stephen Hahn, he would be canned tonight if the vaccine was not approved. Of course, Trump put it all in a tweet in which he takes credit for the vaccine. He calls the FDA a big old slow turtle. Not exactly sure where he's going with that. But again, this is all happening at a time where we need trust in the agency. He also adds, get the damn vaccine out now, when science should determine the vaccine status, not the guy who lost an election and told us this is all a hoax. The FDA has now moved up its timeline and is expected to approve the vaccine today, with each state bearing the cost of storing the vaccine vials at 70 below zero, and each state responsible for their logistics, determining who gets the vaccine first and more, all without any federal coordination. But the feds, they are adding one bit of coordination. They are holding back half the supply of the vaccine at first. Officials, they faced a difficult choice. Either you give more people their first of 2 vaccine shots and wait for new production for the second, or you keep back half the supply so there's enough for everyone being vaccinated early on to get 2 shots.
Does it make sense to you to take the 40 million projected doses by the end of the year and give all those as first doses to people? So you vaccinate more people, at least with some vaccine, manufacture the second dose for them in the following weeks or months.
We considered that, Sanjay, and we decided that it would be more prudent not to do that, namely to get the real total degree of protection, not the 52%, but the 95% after the second dose.
And while all that's happening on the medical and the public health side of the COVID crisis, there is a growing COVID mental health crisis as well, especially among American kids. Mental health-related emergency room visits for children that are up between 25 and 31% this year. People, especially kids, they're having trouble assessing care. And for more, let's turn to psychologist Dr. Jeff Gardere. And doctor, obviously everybody's struggling in different ways, some more than most with COVID, but I spoke to somebody in your field who says the scope of mental health issues, particularly among young people, that there is going to be a tidal wave when the world reopens, and we're going to see firsthand just how much anxiety, depression, etc., is on the shoulders of particularly young people. Do you agree with that?
Absolutely agree with that. Really, when we look at the collateral damage, of course, the many people who have died and been affected by COVID-19 disproportionately have been underrepresented minorities because of health disparities and so on. But another group that's really been impacted has been young people of all ethnicities, races, sexuality, and so on. These are the individuals who very much rely on peer relationships, and all of those relationships have been affected. Just being able to talk to someone on internet, online is not enough to sustain those kinds of relationships. So those young people have been lost. We're seeing that they're anxious, that they're depressed. They haven't had the proms. They're not been able to engage in school activities, sports. And so the residual damage that they are experiencing and will experience, not to mention, of course, the academic losses, are going to be huge.
And correct me if I'm wrong, doctor, but we've seen the widening gap in inequities in every form of life here. But particularly when you have kids who can't go into the classroom, and you mentioned the peer-to-peer, how kids need that, but also they fall farther behind. And you have on top of that, maybe there's unhealthy home environments right there, which even further amp up the stress level. And then you got kids just doing more screen time here, whether it's video games or on their phone. to make up the gaps. It's a really volatile mix, and I can just imagine what educators and folks in your field think that they're going to be dealing with in a best case scenario when the world opens up again in the summer.
You are absolutely right. Educators have been fretting over the academics, interpersonal issues, but the academics, the opportunities that have been lost. Because quite frankly, I'm a professor at a medical school, but I can tell you, in speaking to other professors, other teachers, we haven't gotten the IT thing down yet. We're having significant problems being able to connect with our students online. And then, of course, as you talked about the inequities, many students don't have the proper internet. They don't have the computers. And some of them come from homes that are very dysfunctional, where there's poverty. They come from situations of domestic violence, where they typically were not home when those things were happening, but now they're seeing it every single day and even experiencing it themselves. So it's going to take quite a while for us to catch up on the academics and as well as the emotional issues that are part of this very complex situation.
I had a panel of attorneys on who were just talking about the nuts and bolts of the law, on how we have a fraction of cases being heard in front of the courts and the backlog that's being created as a consequence. On a more critical level, in your field, where you're dealing with people, ranging from trouble to really facing, right on the edge there, do you guys have the bandwidth to handle all the folks that are going to need your kind of help and consult? I mean, are there enough professionals out there to deal with the volume of people who are going to really need serious help?
This has been a huge concern for us in the mental health industry and medical industry, whether there would be enough professionals to deal with the overwhelming cases of mental health issues, of medical issues, and so on. But this is a situation where necessity is the mother of invention. And so what we found, many of the regulatory bodies having to do with medicine, psychology, mental health, have relaxed a lot of the situations where one would have to be licensed in Texas in order to treat a patient in Texas if the clinician were living in New York, as I am. And so what we found is, by relaxing all of the boundaries, now we have enough clinicians to go around, because we're not stuck with regard to the regulation of where a person can practice. We can literally practice anywhere in the nation as long as we're licensed from the place that we are headquartered from. I suspect, and the American Psychiatric Association is looking into this, that even as the pandemic begins to ease, a year or so down the line, the vaccine is out there, the cases are dropping, that we may still allow clinicians to be able to practice over state lines.
Doctor, I always appreciate the time. Thank you for giving us a few minutes.
It's my pleasure. Thank you.
And if you or someone you know is facing a mental health challenge, please try to seek out help, albeit in this challenging environment. Please reach out to Substance Abuse and Mental Health Services Administration. We've got their web address right there, SAMHSA.gov. When we come back, when it comes to COVID and our elections, Americans, they need facts and information, but what they've been getting, particularly with right-wing media, lies, misinformation, and propaganda. It's not just dangerous, it can also be deadly. We'll give you a sample of what we're talking about next.